You know, it's one thing to talk the talk when you're trying to get someone to do something. It's quite another thing to actually walk the walk.
Yeah, in tonight's Buddy Check report, we bring you the story of a healthcare worker who has a lot in common with her patients because she is one. Jessica Sharp has helped countless women with their mammograms as a radiology tech at West Shore Medical Center in Manistee. But last year, she was the one who needed help.
I was diagnosed in June of 2010. I found the lump myself. There was a little bit of denial because of my age. Being 35, I didn't think that it could happen to me. But something in my body was telling me that something was not right.
Sharp's doctor confirmed her fears. She had stage 3 breast cancer. To beat the disease, she had a double mastectomy, 16 weeks of chemotherapy, and 30 radiation treatments. Those treatments not only helped save her life, but also changed it.
When I had my chemo, I had such excellent care at the cancer facility that I from the first day I walked in there, I knew that I wanted to do something to give back.
But since most walkers hit the treadmill in the winter, she knew she'd have to come up with something other than a traditional fundraising walk. The answer was a gift that kept giving.
My husband bought me a pair of snowshoes for Christmas, and I was kind of sitting there thinking about snowshoeing one day, and the little light bulb went off in my head, and I thought a snowshoe event would be an excellent way to get people together, get them active, and maybe do some fundraising to try to raise money for cancer patients, to help cancer patients out.
In its first year, the Snowshoe Stampede had a lot of community support and raised more than $8,000.
It felt good to give back. The Sally K. Johnson Fund just likes to make cancer patients' lives a little easier. If there's something that they can do to make it easier, they will step in and help out.
Sharp says the best advice she can give, both as a specialist and a survivor, is to know yourself.
And I try to encourage them to get familiar with their breasts, do the self-breast exams, because when something different does occur, they will be able to find it. You know, they will notice that it's different, because that's what happened to me.
Because that's what happened to me. Those words give me chills. But she's such an inspiration because of all she was doing while she was fighting cancer.
Yeah, yeah.
But wait, there's more. Jessica and a friend are now training for the Susan G. Komen 3-day walk. And we're proud to say so is a previous buddy checker, Jenny Minard. We told you about her a couple of years ago. She's doing great. And she's also doing a different 3-day walk. Now, do you know about these walks? My mom did it when she was right after she finished her treatments for breast cancer. Your mom also participated in the Chicago 3-day. They're a big deal.
Big deal.
They raise a lot of money for breast cancer research and education. The participants walk 60 miles over 3 days, all while working to make a difference. So congratulations to Jessica. Good luck. Congratulations, Jenny. Good luck.
Yes.
There's a sizable fundraising goal along with these 3-day walks. So what I did is I put links to both of their walk pages with this story on our webpage. So if you can help them out at all, thank you. So look for this Buddy Check report at UpNorthLive.com and see if you can help out Jenny and Jessica. And you know, while you're there, we want to hear your stories as well. If you've been affected by breast cancer, if someone you know has, and their stories of fighting back, log on, share your stories. We can't wait to hear them.
And I would love to hear, and we haven't really talked about this, but just kind of hit me. It would be great if you're doing a 3-day walk.
Oh, yeah.
We would love to follow you on Twitter. If you could
Facebook,
tweet us in your progress, we'd love to follow along and let everyone know how your trip is going, because it's a lot of work and it's a lot of steps to cover all of those miles, and it is really quite